Dr. Roxanne Sholevar is a psychiatrist practicing in Boston, Massachusetts. She specializes in the mental health care of patients who have serious medical illness and in psychoanalytic psychotherapy with healthy adults. She also has specialized training in psychedelic-assisted therapies and research interests, including applications of psychedelic-assisted therapies for existential distress in patients near the end of life. In her words, and this is her therapeutic approach, I work best with adults who are motivated to understand themselves better through depth psychotherapy. While this motivation often stems from life transition, illness, relationship difficulties, or loss, there are times when we simply feel the urge to go deeper and explore our own minds. Dr. Roxanne is a board-certified psychiatrist with specialized training in working with adults with serious illness, which she has found creates fertile ground for understanding and for deep understanding and change. She is curious, fearless, and prides herself in making a safe and comfortable space for her patients to share whatever is on their mind. Together, she helps them create a new, richer understanding of whatever it is that hails you, and in turn, of yourself. So today I bring you guys Dr. Roxanne Sholevar all the way from Boston, Massachusetts. All right, welcome everyone to my interview today with Dr. Roxanne Sholevar, titled Psychiatry, Psychedelics, and Palliative Care. Welcome, Dr. Sholevar. How are you doing today?
Thank you so much, Bryan. I'm doing really well. Enjoying being down here in Miami during Miami Art Week, and really excited to have this conversation with you.
Awesome. Okay, so let's go ahead and get started. All right, Dr. Sholevar, so we're going to start with your childhood. I want to know, where did you grow up?
Yeah, that's always the place to start, right? At the beginning, the origins. I was born and raised in Allentown, Pennsylvania. Okay. It's like a mid-sized city about equidistant between Philly and New York. So I spent a lot of time going between the two cities. And I was born to two Iranian immigrants who actually left Iran and met in the States under a totally different set of circumstances, which really helped shape my identity. And we can go into that later if time permits. But yeah, I grew up there. I went to college in the town that I grew up in. Always knew I wanted to go into medicine. Combination of both family pressures and also just you do what you're exposed to. My dad was a physician, and I had a long-standing interest in particular in the end of life and serious illness. I do believe that sometimes we bring in with us from whence we came some inward predilection or interest, and I do think that there's been something in me since I was born that sort of attracted me to the end of life. And what is that? Not necessarily. Yeah, exactly. Definitely something of a calling. And that's one of the great things about medicine is that there's so many opportunities to create and find the niche that works for you, your interests and skills. So I feel really happy to have landed where I am.
Awesome. That's so cool to hear your origin story as a young. So tell us a little bit more as a young girl in the school years. What were you interested in as a school girl, and when did you get interested in psychiatry?
Yeah, so great question. I do love to think back and try to imagine.
The young Roxy.
The young Roxy, yeah.
Little Roxy.
Yeah, exactly. I remember always being interested in books and reading. That was always like interest number one for me. In particular, books about the human body, like what goes on inside the human body was always a mega interest of mine. And it's funny, my friendship with Gina, which is how you and I met, in early exposure to just images of the organs and the innards and what goes on inside of the person, I feel in some ways translated into my contemporary interest as an adult and professional, which is like what goes on in the mind. Okay. Because in reality, looking back, I imagine as a young girl, what was it that was so interesting about looking at the pictures of the intestines and the brains and the hearts? Yeah, what's going on inside?
So complex, and we take it all for granted.
Yeah, how do things work? What goes on inside?
Childhood wonder.
Love that
Curiosity.
phrase. Totally. Childhood of wonder, childhood of curiosity, and how I got to psychiatry. As I said before, my dad is a psychiatrist.
Okay.
Yeah, there was a lot of family pressure, I think in both good and bad ways, for me to go into medicine. It was always, this is what you're going to do. I didn't really have a super strong alternative idea, so if I did, maybe I would have pushed back, but I didn't. But going into medicine, I never thought psychiatry. I always thought palliative care, oncology.
Palliative care from an early age.
Yeah, because I was always interested in cancer, serious illness.
When did this start, do you think? When, in your teenage years or in your college years?
Yeah, it's such a good question. I think, as I was saying before, I feel I always had the interest.
Because your father was a psychiatrist, you were exposed to it at an early age.
I was, but for the
Did you understand what it was at an early age, or when do you think you started to understand that your father was helping people that needed,
Yeah.
special help with their mind?
That part I feel I had a sense of, but my interest in psychiatry didn't come until the end of medical school.
Okay.
I never thought I would do
Okay,
psychiatry.
so
I
you
thought I
went
would
into-
do palliative care, end of life care, which psychiatry more contemporarily has gotten more involved in.
Yes.
But actually, the attention paid to the mental health of people with serious illness is actually like a sort of newish thing. The fields of palliative
Which is
care,
palliative care, yes.
yeah, and
End of life.
psychosocial oncology.
And the
These have only been developed since the 1970s going forward, which is really interesting when you think about psychedelics starting to be researched in this population back in the 70s, but then got shut down with the Controlled Substances Act. It was right around then that the birth of palliative care and psychosocial oncology came to be. So those fields have developed in the meantime since psychedelics got shut down, which brings us to this interesting place where we are now, which is, okay, there's all this new and exciting research, but we also have no idea how it articulates with these models of care that have been developed to address the well-being of patients with cancer.
Okay.
Yeah.
So before we go deep into your work, which
Yeah.
I want to get all into, tell us a little bit more about your family. Did you have any brothers and sisters?
Yeah.
Any brothers?
So my family is really interesting. I think this might be the time to give just like the brief origin story of my parents, because they both came from Iran, but they came to the US under completely different circumstances. And I think that division and how they relate to our homeland had a lot to do with like how I have come to relate to Iran and Persia as my heritage. My mother's family worked for the pre-revolution Iranian government. So there was like the conservative Islamic revolution in 1979 that basically since then Iran has been governed by a very radical, strong Islamic
The Shah
regime. So yeah, the Shah was before
That was
this
before,
revolution.
and now
Yes.
it's Ayatollah.
Now it's Ayatollahs. Exactly. So my mom's family worked for the Shah's
The Shah's.
government
Okay.
and had like good, stable paying jobs and got an early retirement in the early 70s, like well before the revolution happened.
Okay.
And so they left Iran to come to the States for my mom and her brother to get a better education and have more opportunities before any of that went down. So they left Iran in its heyday of being cosmopolitan, liberal.
In the 70s, they moved to the
My
US.
mom moved in the 70s, but my dad came under totally different circumstances.
Okay.
He was in medical school at the time of the revolution.
Okay.
And he also came from a family that was like very outspoken against radical conservative Islam, and a lot of them were political writers and activists. So they were under a lot of persecution, and they fled Iran to come to the US. So his memories
For the
of
opportunity to keep studying.
so his memories of Iran are like terrified, negative, doesn't feel close and connected to it, whereas my mother's are like very nostalgic, very fond. So growing up, I was living between those two places, and my mom always wanted to take me and my little brother. I have one little
I was going to
brother.
ask, have you visited?
One time only. In 2016, I went with my parents, my little brother, my maternal grandparents, and an uncle, and we went on a 3-week family trip to Iran that was like absolutely transformative
Amazing.
for
Wow.
me. It was
Yeah.
incredible. But it was the only time I had ever been, and now things are so chaotic. I don't know when I'll go back, but
Yeah.
I really hope I can soon.
Yeah, we all hope things get better.
Definitely.
And that we can figure out how to all get along.
Sure.
Very complex history and a lot of cultures, but that's your identity, and as well being a woman, which we want to talk about today.
Yeah.
And we know several amazing psychiatrists, Dr. Scott Fisher,
Yeah.
Gina, your friend, who's interested in neuropsychiatry as well. So let me just do a quick check of the camera. But
Sure.
tell us next. We're going to get into what got you first interested in psychiatry. I think we talked about it. Okay, we're good on the camera.
We're good.
So,
Okay.
yeah. So we talked about what got you first interested. Was that your family, your dad? When did you said after med school?
Yeah, so I think it would be relevant for me to share this arc. So like when I go into medical school, and for those listening who aren't familiar with like how medical training works, you go to medical school to get your MD, and that's like a general, everyone does the same core curriculum. But then after you graduate, you decide on a specialty, and then you go on and do additional training in that specialty.
After the first 8 years?
After your first 4 years college,
And
4 years med school.
So 8 years.
8 years.
And then you get the specialty.
Then you choose your specialty and you go on to do your training in that specialty. So
Okay.
I chose to do mine in psychiatry. You can do it in people, my brother's doing it in surgery, there's people who do internal medicine, whatever. I did mine in psychiatry, which was 4 more years, and then I did 1 final year of subspecialty training in hospice and palliative medicine and psychosocial oncology.
Okay.
So basically like working on the mental health and spiritual, emotional well-being of people that have serious medical illness. I actually didn't decide to go at this from the angle of psychiatry was a decision that I made towards the very end. I was very torn between, do I want to become an internal medicine?
Just comforting people. What is in a nutshell? We're going to get into that a little deeper. But what if psychiatrists are involved? What is involved?
Yeah, exactly. So the options were to become a medical oncologist, which is to treat people with cancer with chemotherapy, radiation therapy, and really focus on treating the disease. Palliative medicine is a branch of medicine that focuses on quality of life, comfort, and a more sort of holistic approach to a patient's well-being as they cope and struggle with a disease such as cancer, but it can be anything that is life-limiting. And so really where I decided to take the psychiatry route is that once I was in med school and doing all my rotations, like working with cancer patients, I realized these are definitely the patients I want to work with, but I don't want to be spending my time thinking about what chemos to give them, what electrolyte disturbance are they having, like what radiation do they need. Those are important things, of course, but I didn't have the time or space to sit with people's more like existential or personal experience and learn about what was going on in their mind as they dealt with this illness. So once I discovered I could be a psychiatrist and as a psychiatrist go and take care of these patients, then it was a wrap. I was like, that's what I'm going to do. And so I went on.
Make a deeper impact in someone's life.
Yeah.
Just helping them with their chemo.
Yeah, and just, I think you need, like, it's so big, all of it is so big that you need like a dedicated person, a dedicated space, a dedicated time. You can't just tack that on to the end of the visit where you are like saying, okay, this is what
you
your
focus
stance.
on more. I think
so.
Mental health going.
I think so.
So, what got you started with psychedelics?
Yeah, so my interest in psychedelics actually came once I began to work as a psychiatrist with patients with terminal illness, because I very quickly realized that the tools that we have available to us to manage people's emotional distress are so limited. We have the conventional medications that all psychiatrists prescribe, antidepressants, anti-anxiety meds, that's a whole separate conversation, but those, even in healthy people that aren't having spiritual distress as a result of dying from cancer, don't work that well. And they take a long time to work. And a lot of side effects.
My mom was a pharmacist, so I am aware of.
You're aware, yeah. So like
it's more helpful. You have to balance out the benefits and the risks.
Absolutely.
So what is your? So do you want to continue on the psychedelics?
Yeah, I'll continue on that. I'll continue on that. I think, to your point, I agree that psychiatric medications can be super helpful for some people. But one thing that also became very apparent to me quickly when working with patients with cancer is that we're not talking about, it's not the same type of depression as like a person who develops a severe mood disturbance and it won't respond to psychotherapy. This is it's a crisis of meaning, a crisis of purpose, a crisis of mortality. These are more like spiritual and existential dimensions, I think, to someone's well-being, and approaching those with the same philosophy of medical psychiatry, where you make a diagnosis, you prescribe a medication, you give the medication. It just wasn't working. Psychotherapy, which is the other thing I am passionate about and do a lot of clinical work in, is also fantastic, but I believe takes a lot of time and effort. It's resource intensive, both like for people have to pay a lot of money for good psychotherapy most of the time. It takes time, and people at the end of life don't have time. So I came to learn about psychedelics from the frustrations I felt with the options I currently have at my disposal don't feel adequate for the problem and the patients that I'm trying to treat. So I started to do some reading, and this was in 2018, 2019, which was right around the time that this sort of second wave of psychedelic research was coming out, and it was all the buzz that was behind the Michael Pollan book and really this popular moment we were coming to. I remember reading the studies and specifically reading the descriptions of what each patient's process was and what they experienced on the psilocybin or LSD journey that ended up helping them. And reading those things, I was like, man, this is the kind of thing that I really want to think about. Like, how can we work with people's minds in a way that is effective, safe, and also works in the way we need it to, which is more rapidly than when someone is living and has many decades to explore and learn about themselves.
That's a different type of psychiatry.
Yeah, exactly. We just don't have the luxury of time with the patients I work with. So that was how I first got interested in psychedelics and their applications to this population.
Okay, so tell us, before we get into the studies you're doing right now and the research that is ongoing right now in Boston, where you live, tell us, what is your overarching philosophy towards patient care as a psychiatrist?
Yeah, so I think that I would say the real thrust of my interest and my philosophy is believing in the power and complexity of individuals' minds. And so like when I think about psychiatry, how the field has evolved in the last 30 to 40 years, there's been so much more focus on biological mechanisms, and we've shifted from mind to brain, right? We ask about symptoms, we have theories about depression means there's a deficiency in serotonin. So if you give a serotonin reuptake inhibitor, that is going to be the thing that fixes the problem. I'm not saying that's not true.
Yeah.
It's just that I feel we miss out on so much when we think that way, which really is. Everyone has a mind, and minds are so complex. They're so individual. They're so dynamic. They're always changing. They're influenced
Just
by
changing
so
one
many things.
input is a very simple approach.
Yes. And when we think about what ideas do people have about themselves, about the world, like these things get formed in such a complex way, and then they like solidify and lead to us viewing ourselves in the world in a certain way that doesn't often allow for the flexibility and creativity that we need to adapt to meet what our lives are asking of us.
Makes sense. It's a very simple prescription. Okay, we'll talk, but it's not really going as deep as it sounds like the psychedelics are going.
And I think that is, to me, the most exciting thing about psychedelics is that they are offering us a way of like marrying this interest in brain and mind, right?
Pharmacology still.
Yeah.
Still pharmacology.
There's fascinating pharmacology research coming out about what do psychedelics do to the brain.
Yeah.
And what the research is showing, it's fantastic. I think what it's showing is that they're creating conditions in the brain that are more plastic and more susceptible to change that can be influenced by social reward-driven interventions like psychotherapy, sitting with another person, sharing what you're feeling, hearing what that person says back to you. We can do that all that we want, but if we're not in a state of receptivity, it's limited, I think, in how well it can work. But what I think is so great about psychedelics is that, sure, they're doing this biological thing that's creating a set of conditions we're increasingly able to measure that suggests that our brains are more plastic and susceptible to intervention. And the subjective experience of being on a psychedelic is also as important of a part of that intervention. What the person experiences, how they make sense of it, what they talk about with their therapist, how it fits in with their problems in life. It's not just about the neuroplasticity. It's about what you experience while you're under the influence of the non-ordinary state of consciousness induced by the psychedelic. And it's essential that it's done with psychotherapy. I don't think it's safe, frankly, at all for people
Which is another topic. This is a very taboo subject, and research is just now emerging to show that psilocybin is very good for treatment-resistant depression. Dr. Scott Fisher, your friend, is doing many studies on that, and as well ketamine and MDMA show promise, and other psychedelics that have been banned by the government are now there's studies being allowed. So we're going to get into that. I just want to ask, are there risks? How do you mitigate the risks? That's through a controlled setting versus someone at home. Like, is there any? There's allergies to psychedelics? Something like just is it? Absolutely. What do you do to make sure this is a safe setting?
Absolutely. When I think about risk and safety, which I'm so glad you asked about, because I think that there's a lot of language being used in popular conversation today that psychedelics are safe. And that's a bit reductive, and I think maybe putting out an idea that they're safe for everybody under any condition and nothing can go wrong, and that's just so not true. As a physician, of course, I'm always thinking about patient safety as the number one thing. There are physiologic risks, or basically things that can happen to the body that are potentially harmful. They're not too bad. It's things like raising your blood pressure, raising your heart rate, things like that. But we are always, anybody that's doing research or treatment with these substances is keeping a close eye on those parameters.
And it's a very standardized dose.
Yeah, in the research that's being done, it's one standardized dose that's being used for the most part. But for me as a psychiatrist, I think the more interesting question and what I know more about are what are the psychological risks of
using people beforehand, getting to know their history.
Exactly. So anytime you want to do any intervention on someone's mental health, you want to know about their history. You want to know what might they be susceptible to developing, especially if you introduce something that could be destabilizing, like a medication, like a psychedelic, even like a psychotherapy. The risks psychologically, and it's tough because like we don't have decades of research proving it, but the anecdotal evidence and our conservative sort of like safety first approach, people that have history of psychotic disorders, people that have history of bipolar disorders, that have a first degree relative with one of those illnesses, people that have like conditions in their brain, like brain tumors, strokes, epilepsy, anything that might make you more susceptible to basically being put into a prolonged state of alteration in your consciousness. With a healthy person, you give them the medication, they have an altered state of consciousness, it wears off. But if there is something underlying in the brain that may make you more susceptible to like getting stuck there, that's one of the big risks.
So
And there have been
history
reports,
is sometimes an issue.
personal history,
Okay.
things like that. But I'll say one word beyond that is that what I'm particularly interested in myself is like, yeah, those are going to be called like the hard exclusion criteria, but what about the stuff we haven't defined yet, which is these are destabilizing psychedelics, right? Like they disrupt your view on yourself, your view of the world, and those are good things that we want something that is disrupted in order to promote healing,
absolutely.
right?
That's how you get change.
But also disruption requires containment so that it doesn't bleed all over the place and get out of control. So then we think about what are the parameters we put in place to help contain that. And number one, psychotherapeutic support.
Okay.
So all of the research that's being done is not looking at what happens when you give someone a certain amount of psilocybin. It's what happens when you deliver psilocybin to a person in the context of a psychotherapeutic process, which is meeting with them for a couple hours beforehand to prepare, get to know them, set intentions, prepare them for the experience, dosing them under a supervised, monitored setting, and then doing follow-up
In a clinical
integration.
setting.
In a clinical setting, doing follow-up integration to help them put the pieces together and make sense of what they experienced. That's what the evidence is for. The evidence is not for taking psilocybin,
Yes,
or at home or whatever. Yeah, that's not what the evidence
So
is.
this is under supervision always, and there's a lot of pre and post
A lot.
work being done.
A lot.
It's not just there's a lot of integrate. I know with psychedelics, it's about integrating back into society
Totally.
too, and putting it all together after the fact.
Exactly.
I do really want to get into we have a limited amount of time today. We're going to have Dr. Roxy back in the future. And I just want to go through a couple of questions before we get into your study. Palliative care. Tell us about what that is again in a nutshell. My understanding is it's end of life care for helping with the mind and your coming to grips with what you're dealing with. But how can psychedelics specifically help that? Tell us about palliative care and your studies, and tell us if you can what you can. I know the studies haven't been published yet on how palliative care can be helped by psychedelics. I know we were talking earlier about it restructuring the mind towards existential distress.
Yeah. So for those that aren't familiar, some listeners might be from like personal experience. If you had a loved one that had a serious illness and had palliative care involved in helping take care of them. Palliative care is a subspecialty of medicine that originated in the 1970s, where the focus is not so much on the eradication of disease as much as it is on enhancing the quality of the patient's experience living with their illness.
Okay. So quality of life.
Quality of life in a nutshell. It's about quality of life. And quality of life is like so multidimensional, right? It's like physical symptoms, managing pain, nausea, all the stuff that comes up as a result of the disease.
Okay.
But it also involves looking after the emotional and spiritual well-being of the sick person and their families.
Okay.
And
is
so
hospice care an interchangeable word?
That's a good question. They're not quite interchangeable. Hospice is a subdivision of palliative medicine that is focused on the very end of life. Patients that have life expectancy of less than 6 months qualify for receiving hospice. And hospice is a set of services that are often structured differently. It doesn't have the patient coming into the clinic to see the doctor. It's actually usually a mobile team that goes around and they go to patients' homes. They bring the nurses, they deliver medications, they make sure everything's okay. So it's more home and patient centered. There are inpatient hospice facilities for people that are very sick, but it's for the very, very end of life.
Okay, so I'm glad we discussed the difference between those two words because they do sometimes get palliative care is a new word to me, but it's a hot subject lately, and it should be. So how are psychedelics specifically helping with palliative care?
Yeah, so there's so much research being done on this, I think, really important interface right now, and in my mind, what makes psychedelics so particularly compelling for this population is one, philosophical orientations, and two, practical considerations.
Okay.
Let's start with the philosophical ones, which is more broad and interesting, and then we'll end with the sort of practical aspects of it. I think, as I was saying before, when you think about the emotional experience of people that are dying, it takes on a different quality than, not to say garden variety depression is all one thing, but there is a difference to it. It's not so much that someone is walking around with a persistent, depressed, disinterested view of the world, despite having maybe some stressors, but most things are going okay in life. Here, at the end of life, it's just a person with everything they have lived through and all of the both helpful and harmful ways they've learned to cope and navigate the world, having those senses of themselves disrupted profoundly by becoming very ill and facing the end of their life. It's often not just the fear of dying. That's what I thought when I went into this field, that it was going to be everyone is just afraid of death and that's what we talk about. Of course that's there, but more often what's there is that people become confused about who they are. What is my meaning? What is my purpose? How do I define myself? I used to be, I know we talked about this before, you're a runner. I used to run and now I'm too sick, I can't run anymore. For me, let's say I'm a doctor. I used to have a lot of energy to go to the clinic and see patients all day, every day, and now I don't have that. Who am I?
It's your sense of identity.
Your sense of identity gets profoundly compromised, and when that is compromised, sometimes you might feel okay, other times you might feel totally despairing and terrible and have big questions about what was the point of my life? What is going to happen to me next? What's going to happen to my family? How do I make the most of the time I have left?
Wow.
So this state of mind, to me, feels...
Healing, also healing relationships, maybe.
Yeah, right.
Coming to closure.
Exactly. And another thing I noticed that your question now just prompted is that what often happens is that in addition to the fear of death and the fear of loss of meaning and purpose and all of this, stuff that people have carried around with them throughout their lives and dealt with more or less adequately for the time being, now there's a sense of urgency of, I want to figure this thing out. I have a strained relationship with my father. I have this complicated view of my body image. Whatever it is for that individual person, that problem is now suddenly brought right up to the surface, right in front of your face, and it's time to either
going
deal
to
or
work.
not.
Yeah,
Exactly. All the ways you use to distract
Which
yourself.
you have the sense of you're all of a sudden, where's my identity? And then those new things that are
Totally.
that you're all of a sudden bearing, and now it's so important that you talk to the family member you haven't talked to in a couple of years.
Absolutely. But those things are hard, right? Those things are really hard. And there's a reason that we go our whole lives without dealing with that stuff if we can get away with it. But that's the sort of beautiful and painful thing about facing a terminal illness, is that it really gives you an opportunity to face a lot of things about yourself head on that you never faced before. And to me, that is not solved with medication. That is solved with a deep process of self-exploration that has to happen in the context of a safe therapeutic relationship with a trained professional, in my opinion, that has experience and skill and ability to sit with you through that. How do psychedelics help with that?
Yes. Specifically mushrooms, right?
Sure.
Just an audience at home.
Sure.
Is your specialty right now?
Yeah, so in the whole community and academic research that's happening right now, psilocybin is being studied more than any other psychedelic for these applications, psilocybin-assisted therapy. And there's a few different reasons for that. When the work first started being done in the 70s, it was usually LSD that was being studied, but now the favor has turned toward psilocybin. Psilocybin lasts less long than LSD, which is helpful oftentimes. Shorter duration is appealing for resources, both for the patients, they might not have energy.
What is the time frame in general?
So with psilocybin, people experience the altered state of consciousness for between 4 to 6 or 7 hours. And that needs to be monitored very strictly. In all the research that's being done, basically you meet with the patient beforehand for a couple of hours, spread out over a few weeks to do the preparation. They do the dosing in a monitored setting. It's usually an entire day that they go to a facility. The 2 therapists that are doing the intervention are there with them the entire time. They monitor them to make sure that they are like totally out of the experience and safe before discharging them home with a family member.
So there's a lot of checks and balances.
There's a lot of checks and balances.
You don't just release them right into the wild.
No, not
These are cancer patients? Is that your specialty right now in your study?
Yeah,
so oncology or cancer?
So the work being done in the field is mostly looking at patients who have advanced cancer. That seems to be the illness that I think for good reason. Cancer is like a huge epidemic in our contemporary times, and also has so much like stigma and like the unique trajectory associated with it, as far as the sort of fight mentality we have towards like battling cancer. Like it has to be eradicated, and we do these like really grueling treatments on people in efforts to get them more time, right? So like people are living longer with cancer, which in some ways
than they were
is a good thing. Yeah, absolutely. Way longer than 30 years ago. That's a good thing in many ways. Of course, if your primary outcome is years lived, but you think about what is happening during those years. Like when people live longer, they're living with terrible treatment side effects, constant hospitalizations. It's not a rosy picture, so to speak. So I think that there is a growing population of people who are living with advanced cancer, and that is not always a great quality of life. So the distress that is around that, I think, increases, which is a part of why there's so much interest.
How does psychedelics and mushrooms help the palliative care studies? What is your research finding? And the plasticity, I always hear about neuroplasticity with psilocybin. And also tell me, is there any detachment of ego, or how does it help break down and how? I'm sure some people are scared when they hear psychedelics because they're worried about losing themselves or about something, them going crazy or something, and they don't want to let go of control. But again, this is end of life. This is people with cancer. We don't want to use the word desperate. They're looking for maybe an alternative approach because they're finding a lot of promise in it. So tell us, how does it help people that are in palliative care?
Yeah, so we're still learning a lot as a field. Like I mentioned, I think at the beginning of our conversation, there's this huge gap that we're faced with right now between, we have stopped research on psychedelics for the last 50 or so years. It's just re-emerging now. And in those 50 years, we started doing a lot of things to look after the emotional well-being of patients with serious illness. Some of the things we're doing work beautifully and are really great, and we don't want to shove those to the side and bring psychedelics in as the main treatment. We want to figure out how they work together. There's so much to learn.
Yes.
But there's a really strong
holistic. That's a holistic approach.
Yes.
It's like you don't exclude modern medicine. And
No. I think that
general care.
You can't, because that is a part of the landscape, and patients are, of course, always going to want to treat their illness, and they're going to want to use what modern medicine has to offer them, as they should. But thinking about how we can bring psychedelic-assisted therapies into that space to support their overall
psychiatry, which it is targeted by medicine, but it's also through psychotherapy.
Exactly.
Okay.
But what we're seeing, and what sort of the really promising signal, is that patients after one treatment, and one treatment includes the prep, psychotherapy, the dosing, and the integration, they have rapid, sustained, and what seems to be durable, meaning it lasts for a more prolonged period of time, improvements in their mood, their anxiety, their spiritual well-being, and measures of what we call existential distress, which is a sort of special set of psychological symptoms that people often facing terminal illness have. Things like loss of meaning, crisis of faith, spiritual distress, death anxiety, basically all the mental stuff that comes with knowing that you're going to die of terminal illness. So people show improvements. And when you actually talk with the people that have had these interventions done on them, the study participants, the patients, when they describe, to me, that's more interesting. It's how did this help you? What was your sense of why this worked? It brings me to what you and I were discussing before the podcast, of being put in that position of facing the end of your life and all of the confusing crises that come with that around your sense of self, your meaning, your purpose. Psychedelics seem to help people creatively reimagine themselves, right? When you're put in a position where the pieces that make you who you are scattered all about by something, loss, illness, disaster, whatever, you're in a position where what are your options? You either drown in that and panic, which all of us will as part of the process, but if you have enough internal resources, and by that sense of self and support from others.
Support's gotta be huge.
Support is huge.
Coping mechanisms you might already have in place.
Support is huge in coping. It's an opportunity for you to creatively move those pieces around and figure out a new way for them to fit together that allows you to adapt more freely, express yourself more freely, connect to other people around you more freely. Because that really is the number one thing people value at the end of life, is connection to themselves, to the higher power, to their loved ones. That's what it's really all about. And you need a cohesive sense of self in order to connect with others.
Of course.
So psychedelics seem to, in my way of thinking about it, they offer some spark to that sort of creative restructuring that, given the right set of conditions and the right amount of support, allows people to do the type of psychological transformation that, in my experience, otherwise often takes many years of psychotherapy, often happening with great
quick results with psychedelics.
Quicker, I would say. Quicker.
Not necessarily fast food type.
Exactly.
That's not what this is either. This is not a quick fix type scenario.
It's about it.
Still.
But it seems quicker, and to me, that's why for this population, some quicker is not always better, but at the end of life, sometimes quicker is all you have.
Sure.
And so if you don't have time to work with somebody for months and years on understanding themselves, I don't want people to be robbed of that, because I've seen the power of that in myself as a psychoanalyst in training, learning the transformational power of deep psychotherapy that happens over years. it can change who you are in a similar way, I think, to what psychedelics are claiming and hoping they can do. And I feel very passionate about bringing that opportunity to people who don't have the resources and time to engage in that sort of like deep, ongoing self-exploration.
So I have a couple of quick questions about the study. Are people awake the whole time? Are they generally conscious or generally talking to you? Are you generally guiding them? Or are there moments where they also go into deep meditation?
Yeah. So in psychedelic assisted therapies research, like obviously everybody's different, but most of the time during the dosing session, patients are pretty inside of themselves.
So laying
down, all studies for the most part do it the same way, where they put eye shades on the participant and the purpose of that is to encourage them to stay inside. Because
the stimulus would be tempting to just get lost in.
Yeah.
We all can understand.
Of course, we all can understand that, and I would even argue that like when you think about the benefit that nature has for people, sometimes when they are in an altered state of consciousness, you can get a lot out of looking at a tree or a flower or anything like this. But if you think about the settings that these research studies are being done in, they're not being done in nature. They're being done in clinics and research rooms and
indoors
and setting, right? Like mindset and setting are super important. So there's a lot of efforts to enhance and provide the best possible setting for the experience. And sometimes that involves putting on eye shades, reorienting the person inside themselves, and listening to music.
That's a big thing though, because most people when they think of psychedelics and psychiatry, they probably think of someone like talking to a therapist on a couch, looking at them, and then thinking, "Oh, your face is melting." No, that's not what they're experiencing.
Not often. But again, it's different for everybody.
Yeah, some people probably report some pretty. You get up and I also have a question. Do you do placebo control?
Most of the research studies that have been done so far have not been doing placebo control.
So you're actually
for psilocybin.
They know what they're getting.
Many of the studies are open label, means the patient is given something that they know what it is. But this is actually, and I have a good friend who's really interested in like having an intellectual conversation around like the placebo problem, because that's one of the big criticisms that scientists and healthcare professionals have about psychedelic research is how can you placebo control something that you know what you're, even if you don't know what you're being given, you'll know maybe within
whether you're having
90 minutes whether you're
exactly.
Yeah, so that's a sort of like sticky spot, and it's something that people are thinking and talking a lot about. But for right now, the main area of focus is not so much is this better than placebo, but can we do this safely?
What are the results that psychedelics are delivering to people in intense need?
Yes.
And let's document this and let's figure out how to do best practices and how to make this more mainstream and accepted.
But there are like bigger research studies being done in like phase 2 and phase 3.
What does phase 2 and phase 3 mean?
So that means that like the size, setting, and study design that is needed for the FDA to approve a drug. So for example, like MDMA is probably going to be the first psychedelic-assisted therapy approved by the FDA. Sometime it's projected in 2024. Don't know exactly when.
Because it's been studied longer?
It's been studied the most. There's the largest body of evidence of MDMA-assisted therapy for PTSD. They have already published all the research studies they need to publish to get the FDA to approve it.
Peer-reviewed journals, many. So this
hundreds of patients, hundreds of hours,
the FDA
many sites. The FDA has to approve it before it has any chance of coming into mainstream medical practice. Because as of right now, with the exception of ketamine, which is a little bit of a different story, all psychedelics, psilocybin, LSD, DMT, MDMA, all Schedule 1, meaning there is no accepted medical use and they are prohibited by law.
Wow.
So the only way to get access to these in a legal setting is to go through a research study. But once the FDA approves one of them, that's going to make the descheduling process much more likely to happen. There's going to be barriers to it. It's possible that the FDA could approve it on issue that, we don't want to deschedule it because it needs to be descheduled for it to be prescribed. Ketamine is Schedule 2, I believe, which means that it has significant risk, but it does have therapeutic use. So there's some control.
Like it's used for pain or is it?
Totally. So ketamine was first used as an anesthetic. That's the most experienced anesthetic, for putting people under for surgery and stuff. But even in the palliative care space, it's been used for pain management for a long time. So we have ketamine. So there's a large body of evidence that ketamine is safe and effective, at least for managing pain in people that have cancer and have a lot of pain. But now people may or may not know that there's a lot of attention being paid to ketamine for depression, and a lot of research being done on using both ketamine as just a straight up medicine and ketamine-assisted psychotherapy
Okay.
as an intervention, just like the ones we've been talking about with psilocybin, where you prepare,
Sure.
you dose with ketamine, you do integration. People are also starting to look at that as well for mental health
assisted
conditions.
therapy. Yeah. So
Yeah.
my friend actually started a ketamine clinic in Miami Beach. A shout out to Ketamine Cares. My friend Jeremy, he just started it 2 months ago, and he's got a physician and he's got a psychiatrist.
Okay.
He was going to be part of this event we're doing this weekend. You'll meet him in the future, but that's really cool. So we talked about that. Leads me to my next question, which is, what does the future look like for psychiatry and psychedelic assisted care? Are we going to see similar to the cannabis industry where people get a license and they can go to a place and you have to? There's going to be a lot of controls, I'm sure, because they don't want kids goofing around with things. There's always going to be that risk. There always has been. But the more you make something illegal, the more it seems that people want to still make their own decisions.
Yeah.
But what do you think the future looks like in the next 5 years, would you say, for the United States and the state of psychiatry with psychedelics?
Yeah.
Do you think it's loosening out?
So that's a big question, and I think that it's undeniable that we are in a moment in history where there is a lot of momentum building behind public and scientific interest in these as therapeutic interventions for what I think everyone can agree on is like mental health is in desperate need of something.
Something that's talked about more than ever. It used to be
Yeah.
very taboo. My younger brother has schizophrenia since he was
Oh,
17,
wow.
he's 40. And my grandma had it too, so it definitely affects my family.
Yeah.
But it's something that was shameful in the past
Totally.
to talk about. And now it's really open. That mental health is something we should always talk about
Yes.
and take as a priority in our life versus just physical health.
Totally. Absolutely.
Society always, we want the bikini body, we want the beach body. What about the beach brain?
Yeah. What about the beach brain? What about the creative brain?
Yeah, the
All those
creative
things.
brain, yeah.
Yeah, so I think that's a great point because I think mental health, serious illness, medical illness, and psychedelics have all been stigmatized for different reasons and different ways throughout history. But we are at this moment in time where I think the stigma is loosening up a little bit in all three of these domains.
Sure.
And they converge on psychedelic-assisted therapies for
And you
mental
can say
health.
in Hollywood, there's Hollywood actors I've heard who have, and people on reality shows now that are done with psychedelics assisted stuff.
Yeah, there's a lot
And
of
reporting
there's a
results.
lot of public conversation about
Yes.
it, but I think the point I want to make to your question of what is the future,
future, yeah.
and you brought up cannabis because I think cannabis is a really good example for us to look at when we consider what happens when industry gets ahead of science.
Okay.
So because cannabis has remained Schedule 1, it's really hard to do research on it. There are a lot of red tape, bureaucratic barriers to getting the licensure you need in order to do research studies on cannabis
A lot of
in
red
all its
tape.
different forms. A lot of red tape. So for that reason, the research has been super slow. There is research, but there's not strong research. Once the industry got involved and recreational use has become more mainstream, now we're in this position, and I work at a major cancer center. I see this all the time where so many cancer patients use cannabis for managing their pain, their anxiety, their mood, their sleep. Just so many people are using cannabis. Even if you're a healthy person, some people use it for sleep, for anxiety, for pain, whatever.
Yeah.
But what we're seeing now is that patients are going and getting their cannabis from dispensaries. And not only, where it's more controlled, but that's where they're not only getting the cannabis, that's where they're getting their advice on how to use the
Oh,
cannabis.
wow. Okay.
Because the doctors don't know.
Oh, yeah.
So there's even been research done on the comfort level that cancer doctors have talking with patients about cannabis, and it's almost nothing. They feel that they don't know. They don't know what to say, but then for the patients, the research, the patients want to hear from their doctors. Because it makes sense, right?
Otherwise, they're going to go to the dispensary and be like, I tend to be anxious. I need something that's going to mellow me out, or I'm too sluggish and I want something to make me more energetic or creative or help with pain or help with whatever,
And it's not to say
digestion.
and it's not to say that people that work at dispensaries have their own probably personal experience with cannabis.
And they might be knowledgeable too,
They might be knowledgeable,
but they're not doctors.
but they're not doctors, and it's also just more about what makes a good patient experience. The patient wants to know from their doctor who they trust.
Okay.
This is what I recommend for you.
Okay.
I think we can really use cannabis, as I see in some ways, a cautionary tale when considering psychedelics, because cannabis, of course, has its risks, but I don't think anybody would say that psychedelics are far more potent, mentally disruptive than cannabis is. If you imagine a scenario where people have rampant access to psychedelics in the community and are able to go and get that and use that and do it on their own and all of this,
All of a sudden it's available at
all of a
CVS
sudden,
or
yeah,
grocery
right.
or what do you
It's
call
like
it, gas station.
that feels to me like a much harder beast to rein
Yeah.
in than people using cannabis, which again, that's running into its own problems
Sure.
that we're discovering.
Of
But
course.
I
You can't
really-
drive and take these
Yeah.
substances. You can't. I mean, the research is coming out, and you think. I mean, do your colleagues, are you seeing a growth in the industry for sure?
I think so. I mean, I think it's undeniable that there is more and more support for this type of research being done at the national government funding level.
Okay.
There's more support for the research being done. I think that the climate of the medical community in general is still mixed. Psychedelics still carry a significant stigma, and in some ways, I think for good reason. People get that they're serious drugs.
Yeah.
They're not like something you take and have a
Powerful.
great trip, and they're really powerful. And so I think part of people's skepticism is a healthy dose of reality, which is that these are serious and we need to know what we're doing before we start prescribing
Of
them.
course.
And also a residual stigma from all the propaganda and public conversation.
I think that's the problem is a lot of people who have used psychedelics or have heard of someone who used it or society's picture of people using it, there's no research or what I mentioned, there's no prep work. There's not a lot.
Yeah.
There's usually no prep work. It's usually just, oh, my friend got something that you're in college and try some, and you're just all of a sudden thrown into this crazy world versus how you're using it in assisted psychiatry. You're doing a lot of base work.
Totally.
To prep them, and so you don't go into it with all these unknowns and like my dad always said, with a lack of information, you tend to manifest our worst fears.
Sure.
So you can have a really bad trip really easy.
Absolutely.
If someone hasn't like told, hey, you're gonna be fine at the end of this. How it works is it lasts 4 to 6 hours, and then you get at the end, it's gonna start wearing off, and the whole time you're still gonna know your name.
Totally.
You don't lose grip with your whole sense of identity.
Yeah.
Like it's not like you all of a sudden don't know how to drink a little water.
Yeah.
You know what I mean? You're still able to function. Somewhere.
Sure.
You just can't drive a car. You should probably be, doing your job.
No, of course. It's about having a dedicated
Yes.
space with dedicated structure to contain the experience. And if there's one thing I would want people listening to take away from this conversation, it's that when we talk about psychedelics in the medical community, we are talking about psychedelic-assisted psychotherapy. We are not talking about taking psychedelics out in the natural setting. And again, that's not to say
Or get more creative. You're actually people that really need help.
Yeah.
That are coming that have mental health issues.
Yeah, that's what, yeah.
It's not just open to the general public.
No, as of now, and this is something I deal with a lot in my work. Like I said, I work at a major cancer center that has a research program that is investigating psychedelics. So more and more patients are learning about this, through reading about it in the media, in the news, in books. They hear about it from family and friends, and they think, oh, this sounds great. I'm suffering so much. I'd love to have this. Then they end up coming to see me in my clinic where I cannot prescribe psychedelics to them. Psychedelics are only happening in a research setting. And the patients so desperately want it. And it's really hard to sit with the fact that they want this thing that I do believe has promise. We still need to learn a lot more, but I can't get it for them. But what I have learned that really gives me a lot of hope is that even bringing up the psychedelic-assisted therapy, even a patient coming to me and saying, hey, I read about psilocybin-assisted therapy for cancer, and I really want that for me. That gives me an opportunity to have a conversation with them that I may not have had before, which is what are your hopes out? Usually when I ask, it really gives me a sense of what it is that they're missing and what the current care I'm providing them is not hitting. And even though I can't use a psychedelic, that still might inspire me to get a chaplain involved, or to refer them to art therapy, or to encourage them to
Figure
journal.
out what's missing.
Yeah, exactly. Figure out what's missing. And I think to me, you can do a lot. You can do a lot with that.
Okay. So just the conversations are powerful.
Just the conversation.
Even if you can't necessarily get them to
Totally.
the study.
Totally.
Okay. What are you most curious about in psychiatry?
Yeah. Wow. What am I the most curious
In your
about?
future for your career?
For my career, yeah. I am the most curious about figuring out what type of psychotherapy and what philosophical orientation of psychotherapy is the most effective for each different psychedelic and for different patient populations. Because when we say psychedelic-assisted psychotherapy, we already listed several psychedelics: psilocybin, LSD, MDMA, ketamine, DMT, ibogaine. Yeah, these are all being studied, and they all produce different, similar but different subjective, non-ordinary states of consciousness, right? And when we say psychotherapy can be so many different things. things. What's conserved across psychotherapies is that it's about talking, right, within a framework that is agreed upon between a patient and a therapist.
Okay.
That has boundaries that will not be violated and all of these things. Other than that, the philosophy of the therapist, the approach, the structure, the frequency of sessions, these are all very different.
Okay.
So as of right now, when people talk about, psychedelic-assisted therapy, this is another one of the huge critiques of the quality of the research, is that there's no standard defined for how many times, what types of things should you be focusing on? Yeah, what type of themes seem to come up more with this patient, with this drug, and
battling some serious illness.
Yeah.
We think of illnesses as physical, but the mental illnesses are just like having cancer.
Totally, and they're also so different for each person. So while I believe we need standardization as a field, both for I think we need it for legitimacy in society. I think we need it for intellectual conversation. Like when we communicate with our colleagues, we need to have shared language in which we're talking about. So when I say, for example, existential psychotherapy with psilocybin, that my colleague in Zurich knows what I'm talking about. We need that. But I don't think we can or should manualize and make it be standardized, because not every drug, not every therapeutic modality is going to work for every person at every moment in time.
So there's never going to be a black and white. It's always going to have some play, which is more holistic too.
Yeah.
Which is better, I think, because it's mechanistic sometimes.
Yeah.
Pharmacology, so we have to look at someone more as a whole person.
Yeah.
And that's,
So the optimist in me wants to believe that psychedelics and psychedelic-assisted therapy are giving us an opportunity to find the balance between rigor, scientific rigor, and standardization, which is required, I think, for safety, and between humanism and mystery and spirituality and individuality, because I think that's getting shunted out of medicine, and that makes me sad and pessimistic for where the future is going, but I feel like this is an opportunity for us to find a way to blend two, and my optimistic curiosity is about what will that look like, and how can I contribute to that.
Sounds like a new age of medicine.
Yes, it could
Versus what we thought.
It could well be.
But medicine has progressed so much. They used to allow cigarette smoking in hospitals. I know my mom in the 70s said that people were allowed to smoke in hospitals near babies being born in, like, on airplanes. Now we would never. You can't smoke within 30 feet of a business. Bars have because people understand better. And the same thing now with mental health. We're starting to turn corners. So
It
exciting.
makes me think that hopefully in 50 years someone will say, I can't believe they used to dose patients with psilocybin in that basement room without any windows.
Yeah.
Now that they have these like dedicated ceremonial nature infused spaces within healthcare environments that are meant for.
They understand better to comfort someone. Like I think before it was very sterile and very like cold, and now it's probably got more of a human touch. And that brings me to my next question. Like I have a couple questions left. So how has your background as a woman impacted your career in practice? Like I've heard that some women make better nurses, although I have many men who are friends who are men who are male nurses. But women in medicine, and also you speak Farsi and are of Iranian background. How does that all play into your psychiatry?
Yeah, like professional identity.
Practice, your career.
Yeah,
Have you noticed differences between you and other people, like men, or from different backgrounds?
Yeah.
Your father was a psychiatrist too, that was a big impact. But as a woman, I guess my big question was, as a woman, how do you feel in psychiatry?
Yeah.
How do women really fit into that?
I have two thoughts. I inhabit a few different spaces within psychiatry, and my experience as a woman depends on the space I'm inhabiting. And what I mean by that is my work as a therapist. Like I work I have a private practice, I do psychoanalytic psychotherapy.
Okay.
I find the community of psychotherapists to be much more like female dominated.
Oh, really?
Yeah, it's much more common to find women that are practicing as psychotherapists, and not just physicians like myself, but like social workers. In my experience, it's much more female dominant than, for example, the research space, which is another space I inhabit as a psychiatrist. There are, of course, exceptions, but it's very male dominant and male driven. And when you get into academia, hospital administration, research, this is a very male dominated space. And I think that my experience, like I'm young, I finished my medical training 2.5 years ago now, and I've been noticing and reflecting on how I have felt in relation to my colleagues and the greater structures of care within which I work as I have matured. In 2.5 years is not that much time, I know, but I think it's been enough time for me to observe that at the beginning, I felt so much like a little like sister tag along.
Oh,
This
you
is
did?
cool. Yeah, this is also cool. I work at a major cancer center.
Okay, so
Yeah.
wide-eyed.
Yeah, super wide. My God, and also just not so sure of myself and like my own voice and how to speak with conviction about what I believe and what I see. And I think that's normal. You need to build experience to speak with conviction about what you believe. But over the past couple of years, through my experience working in research, in private practice, in academia, I've really started to develop a stronger sense, I think, of who I am and what I believe in and how to use my voice in a way that feels like it's mine, which isn't always easy as a woman, I think, especially in a more male-dominated space. It sounds so oversimplified, but it is by experience. People talk over you.
Sure.
People don't listen to you. You have to be like twice as sharp, twice as smart, twice as energetic to get people to really hear what you're saying. Also, when you're a younger woman, people just don't take you as seriously, I feel. My work has been to really strengthen my own muscles and shift the way that I see myself, because that's where it has to start. I have to see myself as someone who knows a thing or two and has seen a thing or two and has ideas. Confidence, which we all build our confidence over time.
Sure. Even as a young man, you feel less confident than as a man, I can speak. But I've also seen in corporations and in business and in society, it's been male dominated for very long, and now it's starting to get more balanced, but we still have a long way to go. So I'm sure you're seeing that still in psych. But it's interesting to note that most psychiatrists tend to be women, and that could be the empathy, that could be the intuition, that could be the feminine characteristics of care.
The caretaking, I think it's really hard to speak in generalizations, especially like these days. And of course, we're not saying that all women or all men are one thing or not, but I do think there are tendencies, and I do think that there is a tendency towards caretaking that women possess that I feel I identify myself, and that sort of receptivity, I think, really does a lot in creating the psychotherapeutic space needed to do good talk therapy. Some of the best therapists I know are men, for sure. And I know some women therapists who are just like not doing it as much, but I do think...
So it's a universal trait that there is a tendency.
Tendentially, I think there is something to it, Okay,
good. That was awesome. I love that section. Now we're on to an interesting question. First I want to talk about Farsi. How do you say mushroom in Farsi? Do you know how to say
Oh my God, I wish I should have looked it up because you're asking and it's so funny that I don't know. Should I just look it up now and say it for you?
Sure.
Okay.
Yeah.
Okay, let's see. While I'm looking it up though, so Farsi was my first language.
Oh wow.
That was my first language. I grew up because my parents are both native speakers. They were just speaking Farsi to me, and my first words were in Farsi and everything.
So you're completely fluent.
But that's the thing, is that very quickly I entered school, and I've gone to English-speaking schools exclusively. So very quickly
You haven't been able to practice it as much.
I haven't been able to practice it as much. Funny enough, it's mushroom.
Mushroom.
So
Is it language have an alphabet like ours? Or
no, it's an Arabic alphabet, or distinct language from Arabic, but an Arabic alphabet. And there are certain words that they just do English adaptations of it that are not too different. There's a lot of also overlap with French, which has to do with
mushroom.
Mushroom.
Is Farsi for mushroom.
Mushroom.
Any other words you want to share? Any philosophies in Farsi or in your culture that you think are important for people to?
I think so. One thing people often don't know about Persian culture and history is many people do probably know it's super old, like thousands and thousands of years old.
Okay.
And people often conflate Islam with Iran and Persia.
Okay.
But it's just so not the case. Like the current Islamic regime that is ruling and in power in Iran has only been in power for the last 40 or so years. Okay. And there is a much, much longer tradition of Zoroastrianism, which is a more sort of pagan orientation towards life that really privileges and worships elemental forces like fire, water, air, earth, and that leads to some very interesting rituals and traditions around death, which we might not have time to get into today, but maybe for another topic. But as far as really having a reverence for the natural world, and what the natural world can offer us and teach us, is a sort of philosophical underpinning that I feel is so true for myself. I feel, especially when I myself am thinking about bigger questions like life and death and meaning and purpose and suffering, I find that nature provides better than any other vehicle I have found for giving me answers to those questions.
Yeah.
What happens when we die?
Yeah.
It's you look at forests and then tell me. So that's one thing. And then the other thing is that there is a tradition of mysticism in Islam, Sufism. And Sufism and Islamic mysticism is where the famous poet Rumi, that most people know about, is based in. Okay. And if you are familiar at all with Rumi, you know that the content and sort of the spirit of his writings is it's mystical at its core, and what we mean by mystical is really oriented towards a unification, a oneness of everything with itself. And the universe is like all interconnected.
That goes into psychedelics.
Exactly. I'm a big fan of Rumi's poetry. And that philosophy, that sort of like ecstatic worship of existence and appreciation for the unity that binds all of us together, that feels really super in line with psychedelic philosophies and ideas, and also just my views as a person and my personal philosophy. Like, I believe in celebrating our existence. I believe that we contain the entire universe within us, as Rumi says, but that we are interconnected with everything around us.
The interconnectedness of psychedelic
Totally. I believe those things.
There's a lot of ties between your culture. Very, very cool.
Yeah.
Outside of psychiatry, what other passions do you have? What does Roxy do when she's not helping people?
Yeah, so I would say my number one passion is like community building and people.
Wow.
It's great because I found
You're a people person.
I'm a people person. I'm a room for people person. I love people. I love bringing people together. I love the spaces that can be created when you bring a certain group of people together and have the right conditions and the right sort of ground for relationships to blossom. That is, to me, one of the most important aspects of my life.
Building. That's
Yeah.
exactly what my Mushroom Fest is about.
Totally. So I spend a lot of time with loved ones and friends, but in addition, I am a creative, so I have multiple different outlets through which I express myself. I do some painting, I do photography, I write poetry. Probably my favorite, though, form of creative expression is public speaking, which I found like an amazing outlet through my work. Because we're doing all this research, I'm working in a field that is a lot of interest in it, and there's a lot of opportunities at medical conferences and different places for me to go and share what we're doing, and it allows me to combine storytelling, where like I decide like what is the arc, what is the narrative I want to communicate when I deliver this talk. I can also do the graphic design, so like putting together the PowerPoint, which is also a big passion of mine, is just visual arrangement and creativity and how that fits in. And then the actual performance. I always wanted to always nurse like a desire to be a performer, but like I can't sing, dance, or act. So I found through this is my way.
Sure.
Because there is something.
You can present your persona.
Yeah, there is something to the self, like using the self as an instrument of expression. And I feel I do that in my professional work and in my more paraprofessional interests, which include public speaking and stuff like that. So.
But when you brought up public speaking, it reminded me that you were featured recently in the Boston Globe in November, so it was a month ago, and it was an article about your work in psychedelic-assisted psychotherapy. So how did that all happen, and tell us what the article was exploring? How did they find you? Did the article come out after and you didn't even know it was going to, or did they contact you and talk to you a lot?
So they contacted the lead in our research team after the hospital I work at wrote up like a blog about the work that we're doing. And they got interested because of Boston's history with psychedelics, and it's the fact that this work is happening again in Boston now is a big deal, given like Boston's history with Timothy Leary and all the stuff that went down at the Harvard Divinity School. But they wanted to write about our team and what we were up to, and it was great because the guy who wrote the story didn't know what psychedelics were until he did the story. So it was really cool to be in conversation with someone who was used to reporting and investigating and how to tell a story, who didn't know about these things, and fill him in and see what kinds of questions he asked. And
that's going to a big audience. The Boston Globe is one of the
legit.
best known entities out there. That was just last month, so that's really exciting. Congratulations.
Thank you.
I think that pretty much wraps it up today. We're just really excited to have you here in Miami, Roxy. We're going to have you back in the future, Dr. Roxy. And Miami Mushroom Fest was really excited to work with you this year, and we hope to keep you part of our organization in the future, that you can help Miami become more educated about these topics. And it's just been really fun to get to know you today. So thank you so much for coming here and sharing your time with us.
Thank you, Bryan. It was a really fun conversation.
Awesome. We'll do it again. Awesome. Okay, thanks, Roxy.
Okay.
Thanks, guys.